Hello, here I am with the orthopedic surgeon at Northwestern Medical Center. I have a simple question to ask him regarding lifestyle medicine and surgical optimization. Tell me how you succeed to convince your patient to come to lifestyle medicine for surgical optimization as opposed to them just going to have surgery done somewhere else.
I think it's the approach that you take with a patient. We have patients that are in need of a total hip or a total knee. The weight is a big factor. There are various things that we may want them to optimize, whether it's their weight, whether it's their diabetes, smoking, and other issues. And when they have a painful joint and they're motivated to have it repaired or replaced, there's an incentive for them to try to optimize. So I go through a discussion with the patient, the implications of those problems and the increased complication rate that can be associated with their excess weight or their smoking or their diabetes. And so we basically set criteria for proceeding. So if you look at a total hip or a total knee in a patient that has a BMI over 35, for example, the infection rate is 7 times higher. And with the BMI over 40, it's greater than 10 times higher. And so my goal and the patient's goal is the same. We want a perfect outcome. How do we get there? We get there through optimizing their medical conditions prior to proceeding with surgery. And the nice thing about lifestyle medicine is that it's a one-stop shop. They go through the dietary considerations. They go through the exercise program. There's physical therapy involved, registered dietitians that are knowledgeable about maintaining a quality nutrition while being able to assist them with weight loss. And they're weighing in intermittently every week or two. And so there's an incentive for the patient. And the patient generally understands that we have the same goals in mind. We're in this together. It's not a we versus they. It's together to get a good outcome. And with that discussion and that motivation, I think in orthopedics we're actually well positioned to try and modify these behaviors, because patients that have diabetes won't necessarily feel the outcome, but if they've got a painful knee and they have to get their hemoglobin A1C down below 7, they're now motivated. So I think we have a little bit of a lever. It's an opportunity for us to help optimize patient health.
Thank you very much. Really appreciate it.
You're very welcome.